You ever stop to think about how a new, life-saving medicine actually gets made? I mean, how it goes from just an idea in a lab to something you can pick up at the pharmacy? Well, behind every single one of those breakthroughs, it's not some lone genius in a white coat. Nope, it's a huge, incredibly complex team of professionals all working together to make it happen.
So who are these people, right? To really get our heads around this, let's think of a clinical trial like a big Hollywood movie production. You've got your studio execs, your on-set director, all kinds of specialists, and a whole network of people making sure that final cut is absolutely perfect. So today, let's meet the whole crew.
And just like in the movies, everything starts at the very top. At the heart of any clinical trial, you've got two main leadership roles, the sponsor and the investigator.
Okay, check this out. The sponsor, they're basically the studio executive. They're the ones with the big idea, the ones who get the ball rolling, manage the whole thing, and, pay for it all. But then you have the investigator, and they're the director on the ground. They are medically qualified and have the final say on site, making sure the plan is followed, and most importantly, that patients are safe. It's this balance, the sponsor's big picture vision and funding, and the investigator's hands-on responsibility, that's the foundation for literally every single trial.
All right, let's zoom in a little bit, down to the film set itself. The director can't do everything alone, right? Of course not. They've got a whole on-the-ground team, the site operations team, handling all the day-to-day action.
So first up, we've got the sub-investigator. Think of them like a specialist director on set. Like the director of photography who's only focused on the visuals, or maybe a stunt coordinator who's handling all the action sequences. They bring a really deep expertise in one specific crucial area.
And here's why they're so important. By focusing on just one piece of the study, they bring a level of knowledge that the main investigator might not have. And because of that deep expertise, they're actually empowered to make key decisions for the director, making sure every single technical detail is absolutely perfect.
Now, if the investigator is the director, then the clinical research coordinator, well, they're the indispensable production manager. This person is the real heart of the trial site, the one who knows exactly where everyone and everything is supposed to be at all times.
So basically, this person is the glue that holds the entire on-site operation together. They're juggling all the daily tasks, they're the go-to person for pretty much everyone, and they have to be incredibly flexible. Because let's be real, research is always unpredictable.
Okay, so we've got our leaders, and we've got the on-site crew, but how does the studio executive know what the director is actually doing on set? How do you make sure everything is high quality and safe from a distance? Well, that's where the Oversight and Support Network comes in.
So, meet the Clinical Research Associate, or CRA. Think of them as the producer who periodically visits the film set. They are the critical communication link, the eyes and ears on the ground, making sure the director is following the script and that everything is being done correctly and safely.
And here's what's so vital about this role. They have a dual reporting duty. They give feedback to the investigator right there on site, but they also report directly back to the sponsor. This creates this essential unbiased feedback loop, which is pretty much the bedrock of quality control for the whole project. The CRA is the ultimate guardian of the trial's integrity.
At the end of the day, a clinical trial is really all about one thing: producing high-quality data. And the person in charge of this incredibly precious resource is the data coordinator. You can think of them as the true masters of detail on the team.
Their whole job is to gather every single piece of information from the trial and make sure it's compiled quickly, efficiently, and most of all, reliably. Because without clean, accurate data, the entire study is basically meaningless.
Next up is the guardian of the rules, the regulatory coordinator. And you can make a pretty strong argument that their job is the most important one on the entire team, because their focus is on one thing above everything else: keeping patients safe.
Their entire mission is to make sure the trial is ethical, that it's legal, and that it's operating within the super strict framework designed to protect people. This role is absolutely critical for maintaining the public's trust and, of course, the safety of every single person who participates in the trial.
Now, sometimes the studio, our sponsor, needs to bring in an outside company for a really specific job. That's a contract research organization, or CRO. Sponsors can hand off really complex parts of the trial, like managing safety data or quality control, to these specialized expert groups.
And for even more specific needs, you've got vendors. These are the freelancers of the clinical trial world. Maybe it's a company hired to provide a special piece of equipment, or a unique software system, or some other specialized service that helps the study run faster and more smoothly.
Phew! So, we've met the whole cast of characters, but how do they all actually work together?
Well, it's kind of like a carefully choreographed dance, where every single person's steps matter.
Let's just walk through a really simple example, the flow of data. First, the data coordinator on site compiles all the patient info. Then the CRA comes to visit, monitors what's going on, and verifies that the data is accurate. And finally, the sponsor gets those clean, verified reports so they can analyze how the trial is going. See? Each role totally depends on the others to do their job right.
So that's nine distinct roles we've just talked about. Just think about that for a second. 9 different kinds of specialists, all working together from the high-level sponsors all the way down to the people managing the data on the ground.
And what this all really comes down to is a simple but pretty powerful truth. These aren't just job titles on a spreadsheet. Medical progress is a deeply human thing, built on the collaboration of a whole team of people all working toward one single goal, to advance science and improve all of our lives.
So the next time you hear about a new treatment or a new medicine, remember this crew: the sponsor, the investigator, the coordinators, the monitors, all of them. And maybe just ask yourself, what breakthroughs in your own life were made possible by a dedicated and mostly invisible team just like this one?